with the Dr. Phill family.
I know that you are an addict.
You say I need rehab, and I don't.
Inside Alexandra's prescription drug use.
Why did you go to a doctor 112 miles from your house?
This is for pain.
They give you 2 bottles of that?
Yeah, because one has a count and then the rest has another count.
It's time
This has derailed your life.
for a wake-up call.
You know what I think? You need to be detoxed. You're addicted to prescription drugs.
But when Alex goes missing,
I am not a crackhead, and that's how you're treating me. I'm done. I don't want your help anymore.
her father goes searching.
This is about the 7th time I've tried to call Alexandra today. You're beginning to really worry me.
I think Alexandra has stooped to some really low level to get money, to get drugs.
My fear is that she could die before we can get to her.
Alexandra in danger.
Many of you are writing into the show wanting to know more about what's happening with Alex from the Dr. Phill family. Well, last week we got to see a glimpse of Alex's life and what it's like living out of a hotel room, struggling to make ends meet. Plus, we got to hear why she says she chooses to keep out of her children's lives. Now, I know there are a lot of unanswered questions about Alex's possible drug abuse, and today I plan to drill down on Alex to get some answers. But first, here's what's happened so far. Were you taking drugs during the pregnancy?
I went to a pain clinic because I was having problems with my back, and I guess I was taking prescriptions, and everybody thought that I was some sort of drug addict, but I'm not.
Oh, there he is!
Are they going to test it for drugs?
She really does have to. Do I need to call security?
You need to test the baby for drugs.
Oh my God.
The baby was, sadly, born addicted to drugs.
Are you smoking PCP, meth, heroin?
I'm smoking PCP.
Well, what are you smoking?
I'm not smoking anything.
Did you fail a drug test?
Yeah, my drug test came up positive for methadone, not methamphetamines. My mom's so ignorant, she doesn't know what methadone is. She heard meth and thought I was smoking meth.
Are you still taking it?
I have a doctor's appointment coming up, yes.
You would have a hard time stopping it on your own. I think you're a drug addict. Because of the addiction, you are driven to service the addiction. You have to get the pills, so you become very survival-based.
What else, Alexandra? What else could there be? I already know you take drugs. What is it that I don't know that could possibly be worse than you being a drug addict? You're a prostitute? All I see is my beautiful 22-year-old daughter who is probably going to be dead within a year if she keeps doing what she's doing.
Now is the time to confront Alex about what drugs she's taking, how much she's taking, and where she's getting them. You think you're addicted to oxycodone?
I'm not going to answer that.
Well, I think you know you're addicted to oxycodone, and if you don't want to say it, I'll do the talking. Would you like to be where you didn't have to take any pain meds at all?
I've been where I don't have to take them, and I still experience excruciating amount of pain. I can't find anything that helps me get through the day. Even with pain medication, I still have pain. It's just hard.
Alex got a lot of problems. Obviously, she's got a problem with drugs, and she needs help. Alexandra's got a broke back. That's a hellacious problem, you know. That's painful. I mean, I understand, you know, there's a difference between taking your medicine and doing medicine. She has a problem. She'll admit that. And you know, that's the first step, you know. I've asked Alex about the rehab thing. I'm going to again. Alex keeps telling me she's not ready for rehab. But I don't think anybody's ever ready for rehab. I'm going to do everything I can to try to get her in that rehab. I'll go with her. You know, I want the best for Alex. That's the mother of my only child, you know.
If there was a way to manage it without pain medication, you would prefer that, right? And I'm not saying there is, because I don't know all of the physiology of your injuries, other than I know that you have legitimate injuries. That's not what I question. I do, in my opinion, think you are addicted to prescription medication. And I think we have to find a way to manage that, because if not, you just kind of stay in a semi-trance all the time, taking pain meds. You went to see a new doctor?
Mm-hmm. We are going to Orlando to my doctor's appointment. I am telling you, this is not good, because you're going to get me in trouble with the camera being here.
Why?
Because this is a pain management office. People are sensitive about it. You can't walk out and in and out of the office. You can't come out to your car. You can't walk around. You have to sit down. And especially, you cannot have a video camera. Can you have a video camera in any other doctor's office?
I don't think they'd get mad and not treat me if I did it.
I'm just telling you how this works. I've been here a couple different times, so I'm telling you. This is for to help me sleep. I got ibuprofen, and then this is for pain.
All right, there was one more, wasn't there?
Yeah, it's the same bottle. It's the same thing.
They gave you 2 bottles of that?
Yeah, because one has a count, and then the rest has another count. I am happy that I have medicine. I took some for my pain, so hopefully my back will stop hurting here soon. The doctor was telling me that my arthritis is getting so bad that I probably won't be able to walk by the time I'm 40. I need to think about physical therapy. I experience a lot of pain, and it's almost like crippling because I can't sleep, I can't stand up straight, I can't sit, I can't bend over, I can't pick up my kids, so I'm not sure how else to manage my pain.
And he gave you new prescriptions, right? Mm-hmm. So you don't have anything illegal. That's not what I'm saying.
Oh.
You have legal prescriptions.
Yes.
Why did you go to a doctor 112 miles from your house?
Coming up.
What do you want me to say to you? I want you to say, Mom, I realize I have a whole big problem with drugs and I'm going to rehab.
I have pain every day,
And
which
there
you
are-
have no idea how to deal with.
I do.
Tomorrow on an all-new Dr. Phill, they gave up on their families,
Your sister didn't even come to your wedding.
but their families
You do believe this is a cult?
Absolutely it is.
aren't giving up on them.
Elon, why are they separating us?
We set up a surprise meeting and our hidden cameras were ready.
The voice was different. I don't want to see it. The gaze was blank. It was not the same person that I had known.
Then on Thursday,
My granddaughter was molested by her father.
was a child's innocence stolen.
You haven't touched this daughter.
Never.
Are you willing to take a polygraph?
That's Thursday. We now return to the Dr. Phill family. Alexandra in danger.
Why did you go to a doctor 112 miles from your house?
Because I am not 25. And in Florida, the pain management laws that have changed. Barely any doctors will see patients under 25.
Well, there are 72 clinics between you and the one you went to, and I had them call several of them this morning, and they said that they didn't have any 25-year-old age limit.
Of course.
What do you mean, of course? I mean, there's no point in driving 112 miles. That's all I'm saying. If you have to have the medication, you don't have to drive.
I like my doctor. When my other doctor's office closed down, they gave a referral of doctors in the area. And that's the doctor that I chose.
But this is the first time you've seen him or her?
Yeah.
This doctor is a new doctor? Well, I need to tell you the 2 medications you have don't go together well. They're dangerous. You need to know they're dangerous. They can potentiate one another in a way that really makes the impact unpredictable and high risk. And I think you should get a second opinion about the specific medicines that you've been prescribed, because they should not be given together, in my opinion. And I'm not a physician, but I've dealt with a lot of addiction, and those two medicines don't go together well. The new one that you're on, to be prescribed to someone that is high risk for addiction, is really dangerous. And if you don't know this, I mean, I don't want you to say, well, boy, I wish somebody had told me this, 6 months ago. So I'm telling you, I think you need to get a second opinion.
I hear what you're saying. I appreciate that. Thank you.
What do you think about me saying, based on my observations and knowledge of your history, that you are addicted to prescription medications?
That's your opinion, and you're entitled to it.
Do you disagree?
I'm not going to answer that.
I do think you're addicted to prescription medications, and I think it is highly dangerous for you. I think what you've been given now is highly dangerous, and I think you do have a legitimate pain syndrome that needs to be dealt with, but I don't think you can deal with it with these medications, because I think they are going to rob you of your motivation. I think they're going to rob you of your health. I think they're going to rob you of your future. They can rob you of your life, particularly taking these together. I think you are at high risk for a super bad outcome. You talked to your mother about this. Take a look at this.
So what about stopping the drugs? What about that?
What do you want me to say to you?
I want you to say, Mom, I realize I have a whole big problem with drugs and I'm going to rehab.
God.
Because I want to be straight. But you know what? Being high is great because you don't have to deal with anything when you're stoned. And the guilt you feel because you're not taking care of your kids. I get that. I do get that.
Maybe you should understand that I was in an accident and I have pain every day,
And
which
there
you
are-
have no idea how to deal
I
with.
do.
No, I have early onset rheumatoid arthritis. I have degenerative disc disease. I have a back so screwed up that I have to feel pain every day.
You can deal with it with other things besides medication.
Right.
Okay?
Okay, Mom. Okay.
You've just gone immediately to snorting hydrocodone and Oxycontin.
And you have proof of this, that I still do that, huh?
Well, right now your pupils are completely dilated. Alexandra, do you think that I want to say this stuff because...
I don't know why the you say it. Why? Why did you have to say... Why do you have to bring it up now when I'm here trying to spend time with my son?
Because I want you to say, I need rehab.
Okay, well, that's not gonna happen, so you can stop.
Why?
Because I don't.
You're never going to go to rehab.
No.
Ever.
No.
I think you do need rehab, and I think you should go to rehab, and I'll make rehab available to you if you want to do it. But I don't need you to tell me that you don't want to do that. I get that. But I tell you what I do think you should do, and I bet you will agree to this, is I think you should see one of the leading spine specialists in America at Cedars-Sinai Hospital and let him figure out what's wrong with your back and give you some answers. And I think that we should get you in there and get you evaluated. And I think if that got resolved in some way, truly resolved, I think you'd have a very different attitude about the pain medication. If I set you up with one of the top specialists to evaluate your spine and figure out what's going on, will you embrace that? Will you do that? Tell me what you're thinking right now.
I don't want to focus on my back pain. I just wish that I could focus on something else in my life.
But you got to get it out of there.
I know.
As I sit here right now, I know, as sure as I'm sitting here, that you are an addict, and we're going to have to deal with that. I want to tell you, I have burned up huge favors to get you into this spine specialist on Monday. I have your promise you'll be there.
Yes, I want to go. But also, I'm supposed to sign up for school Monday because my classes start Monday. And that's really important to me, too.
And whatever we've got to do on the other end, we'll figure it out. We'll get it done. I want to get you on the road to health, Alexandra. This is crazy. This is crazy. We got to get you on the road to health.
We are on our way to see the spine specialist. I am a little nervous because I haven't really been to see an actual doctor for my back since I've had the accident. I've never seen a specialist.
Hey, thanks for taking a minute to chat about Alex.
So what's up today?
Alexandra has had a bit of a rough ride, and in my opinion, she has a serious addiction to prescription medication. I can't prove that. There's a lot of things that point to it. Here's the thing. She reportedly had an accident April 9 of 08, automobile accident. Wore a back brace for 6 months. I think once she had pain meds, and I think she got addicted to them. So I'm very concerned that she needs to be in a serious inpatient rehab facility. But the confounding factor is I do believe she has a legitimate back problem. I don't know what all's going on, but I'm in a situation where I feel like she has an addiction. She is resistant to going to any type of rehabilitation. So I thought it would be good if I could get you to take a look at her and see what you thought on all these fronts.
You know, if she's got a back problem, this to me, I'd look at it and figure out whether it's something that we can fix.
I was very concerned when I last saw her and she said she had been to this pain clinic. I don't know this doctor, don't know the pain clinic. From what I understand, I think they dispense a lot of medications.
Dr. Phill, the problem is that unfortunately, there's no way to really gauge her true pain level at this time. With all of the pain medication she has on board, and with her, I think that she just is going to definitely need inpatient detox and some form of counseling afterwards to help get her off of these medications to get a truer sense of where her pain level is and to accurately treat her.
Well, it sounds like we've got a great plan, and I knew I was coming to the right place. I'll be anxious to see what comes out of the evaluation, so I'll wait to hear from you guys.
Coming up.
We met with Alexandra, and she was on enough medications that would put both of us to sleep.
You should let us put you somewhere to detox you and get you where you need to be.
We now return to the Dr. Phill family. Alexandra in danger.
Hi, I'm Alex.
Hi, I'm Carrie. I work with Dr. Johnson and Dr. Berkeley.
Nice meeting
you. Welcome. What we're going to do is fill out a little paperwork first, and then we're going to have you have a seat.
We met with Alexandra, and she was on enough medications that would put both of us to sleep right now. And we did some x-rays. It looked like she had an old fracture, probably healed. I don't think she's going to have a surgical problem as my guess. Just, I've done this so many years, I can tell you that it seems unlikely. In any event, she's on a ton of pain medications.
My gut feeling tells me that I think what we should do is have her go through inpatient detox, not just for her health purposes, but because this pain issue that she's having may in fact just clear up on its own if we can get her off the pain meds.
Did you need to do any kind of follow-up visit or anything?
They want me to get an MRI and then call and reschedule.
Okay, cool.
We are leaving the doctor's office right now. Everything went really well, I think. I really did feel like the doctor kind of knew what he was doing. He kind of made me feel a little bit more relaxed and calm. I do believe this is a good step in the right direction towards managing my pain.
So you saw Dr. Johnson and Dr. Berkeley?
Yes.
And so how'd you like them?
Dr. Berkeley was really down to earth. I really thought that, he was helpful.
How about Dr. Johnson? Did you talk to him much?
Briefly, but he was really nice too.
Cedars-Sinai is one of the obviously top hospitals in the world. And they head up a spinal unit over there that people come from all over the world to see them. They did the evaluation on you. Mm-hmm. They do not have the detailed reports back yet from the MRI, but we've gotten their initial downloads. I wanted to share it with you. First off, they say clearly you have injuries to your spine. And I swear, sure as I'm sitting here, I did not pre-program this because I'm concerned about your drug consumption. They are concerned about your drug consumption. Dr. Berkeley thinks that the medication you're on could actually be making the pain worse.
Yeah, we talked about that.
Yeah. And if you have a dependency on that medication just based on the length of time you've taken it, you need to get off of that when you have something to put in its place. I know you're really defensive and resistant about that, and I don't know why. Nobody's accusing you of doing anything wrong. We're not saying you're like party girl drug addict. but you are addicted to some pain meds that aren't helping you. So you've got to deal with the addiction, and then you got to get the right meds to get this under control. You may need additional surgery, but they were very clear that this is something you need to fix now. Tell me what you're thinking.
Well, I'm glad that, they were able to help me, kind of, I guess, put on paper where my pain was and how, how it's affecting me, and that, because I think it's kind of hard for my mom, because I guess she has the same back injuries, or she has similar back injuries to mine, and I guess it's kind of hard for her to accept that I feel pain, I guess, when she doesn't. So, it kind of helps me to have something to bring back to her, to be like, look, I really do have pain. This is, how I am hurting. But it's nice for me to, I guess, be presented with different options for managing it.
You can't accept that and then reject what they say, that the meds you're on are wrong. Those are the wrong meds for this pain, that it will make it worse and at best not help. And that you are dependent on those meds. We've got to get you off of those. You've got to detox off of those and do the right things to get this under control. And to detox off of there, you're going to have to do two things. One is physiological, which is medically supervised, and two is the psychological, because the dependencies are two categories. They're medical and psychological. You should let us put you somewhere to detox you and get you where you need to be. That's what you need to do next. And that's what I want you to do. So what do you say?
Coming up.
This has derailed your life. You have 3 kids that aren't with you, and
I really don't want to go there.
Why don't you want to go there?
We now return to the Dr. Phill family. Alexandra in danger.
You should let us put you somewhere to detox you and get you where you need to be. So what do you say?
I'd like to get into school and get to a house and have a stableness in my life before I, take, I guess, the next step towards what you're asking me.
Mm-hmm. Do you believe you need to do it?
Well, for me, my pain, what I'm on helps manage my pain. It does. I mean, for me, it helps. And
you may help it, but it's inefficient. I don't want you to live with chronic pain. That's not the option. The option is to get the right meds, if any, to get any procedures done that need to be done to relieve you neurologically. You have to do that, but you can't just say, well, I'm going to continue to be dependent on these pills because it's going to age you super fast. You're going to have to take more and more of it in order for it to have any effect on you at all. And that's going to send you into a tailspin. You have to get off of this medication. Why are you so resistant to that?
Well, 3 years ago when I had my accident and I was prescribed medication for pain, the same stuff I'm on now, then they thought it was going to help. The doctor I saw after that prescribed me the same thing. My family doctor even told me that he asked me what I was on for pain and agreed with that. So, I'm confused.
But all of that wisdom led you to having a drug-addicted baby. They're not treating the patient, they're just treating the symptom. Wouldn't you prefer to never have to take another pain pill again the rest of your life?
Yeah.
It took a while to say that. I mean,
that's not possible. That's not realistic.
It is realistic. That could well be the outcome. What you want is to be pain-free, right?
Yes.
And if you're pain-free, then you don't need the meds, right?
Right.
So you wouldn't want to take them anymore, correct?
Right.
Or if this is your addiction talking and you just want to keep taking the pills and don't want to do anything to stop that, I can't stop it. I can't keep you from going to some pain clinic down there and some guy writing you a script. I believe you are addicted. I believe you need to go into detox and rehab and get off of it and control it in the appropriate way. And then you're going to be able to get traction in your life long term. And all of this can be over in a matter of weeks. Do you agree or disagree with that?
What Dr. Berkeley and I talked about, the way he described it and the way you describe it are two totally different things. And the way that he describes it, I completely agree with. The way you describe it, I don't really.
Yeah. What are the differences between what I'm saying and what he's saying?
The way you're describing it, it makes me seem like I'm drug dependent. I go out and search for illegal drugs, and I am abusing more than I'm supposed to be taking. And the way he describes it is my body needs it because I've been on it for so long. He described it better.
I agree with him. And I think I've said, I mean, I can go get the tapes and play it to you. I've said, I don't think you're like some drug addict out, getting illegal drugs in the alley. That's the problem today. You don't have to do that. I've said you are addicted to prescription drugs that you are getting from a licensed physician. Mm-hmm. Now, I know you've bought them before, not from a licensed physician, or at least you said you have. But you get them from a licensed physician. You can get them off the internet, for God's sakes. I mean, that's the problem today, is people can get these things too easily. So, okay. I know you're addicted to these drugs.
You've said that quite a few times. I hear you. I've heard you. I'm listening.
And I know how to get you off of them. And when you're ready to do that, then I'll help you do that.
Okay.
But it has to be your call.
Exactly.
And I'm not trying to make you do it, am I?
No, but you said it like almost the entire time that we've been here, and like I'm really tired of just talking about that.
Well, the reason I keep talking about it is because you fail to acknowledge it. If you never
acknowledge it. I know. Trust me, I know.
You know what?
I know at the end of the day that I need these. I understand that. I do. And I don't need everybody every time I go somewhere to be like, it gets a little old.
I usually say things until the light bulb comes on where I at least see that somebody gets it. But this has derailed your life. It's derailed your life. You have 3 kids that aren't with you. And
I really don't want to go there.
And there's not much chance of getting them back till you get healthy.
Right, okay.
Why don't you want to go there?
Because I thought this was talking about my back and my pain, not continuing to talk about my medication and what I'm on and where it's taking me. I don't want to talk about that. I'd like to talk about positive things.
I'm trying to get as positive as I can. It's all rolled in together, Alex.
And I understand that. Trust me, I get that. I don't need anybody else to point that out to me. I really don't.
The only positive things that we have to talk about is getting you returned to health. Okay. And when you are returned to health, then education, career, and all of those things help them, but you got to get returned to health. Well, you can be defensive about it, but you know I'm right.
Okay.
Coming up.
I am not able to get a lot of cash. I might be able to get...
Okay, then I'm done. That really is... I am not a crackhead, and that's how you're treating me.
That's not true, but I will call you back. All right?
You have 30 minutes.
We now return to the Dr. Phill family. Alexandra in danger.
I'm wanting to change your momentum.
This is really hard for me to watch because Alexandra is a beautiful, articulate young woman.
If you would have a hard time stopping it and you know it, then you're going to tell your doctor that.
Yes, absolutely.
She's lying. Of course, everybody thought, again, I was being the evil mother.
Are they going to test it for drugs?
It was the baby's life that was important. Her son had to be on morphine for 4 weeks, and his withdrawal was extremely severe. She didn't take the hydrocodone right after her car accident. She didn't start taking all this crap until she hooked up with Tony 6 months later. And that's when she started snorting it, because she said, it doesn't say how to take it on the bottle, Mom.
When we found out Alex had been panhandling and living out of her truck, we arranged a safe place for her to stay. But all along, we've refused Alex's request for cash. After she returned home, she reached out to one of our producers, Beth. Here's what happened.
I'm sorry, what are you doing tomorrow? You're getting your truck fixed? What's wrong with your truck?
Dad is a mechanic, and I gotta pay his dad, and that's what I was kind of depending on.
I'm able to get gift cards approved. I am not able to get a lot of cash. I might be able to get...
Okay, then I'm done, Dad. I'm done. That really is...
I am offering to help you. You just don't want the type of help that I'm offering.
I don't want gift cards. I don't want
It's as good as money, Alex.
If I'm the gas station I land at, I don't want to have to call and ask for a gift card. I am not a crackhead, and that's how you're treating me.
I'm not treating you like a crackhead.
You don't give a crackhead cash. You give them freaking gift cards. That's exactly how you treat a crackhead. Okay? And I am not a crackhead. I'm a freaking person, and you don't see that. I asked you for a little bit of cash so I can get through the week, so I can get out of this hotel room and maybe go do something fun. My time is important too, damn it.
Alex, honestly, can you please speak nicer to me?
I'm tired of waiting on everybody else. I'm important too, and nobody else sees that.
That's not true, but I will call you back. All right?
You have 30 minutes.
As I've said, while we've been willing to afford Alex some opportunities to stay safe and have a roof over her head, we have denied her request for cash because I was simply afraid that it was going to be used for drugs, and I am not going to enable her in that way. Well, shortly after, she went missing, and she stopped returning our calls entirely. Now, I had told Alex, as long as you and I are communicating, I'll communicate just with you. When she cut off the communications, then it's a new day, it's a new deal. And I felt like because she had gone off the radar, I needed to alert her family. So I decided to call and speak with her mother, Erin.
Hello?
Erin, it's Dr. Phill.
Hi, Dr. Phill.
Now, what we've said to Alexandra along the way is, look, we want to help you, and we define help as keeping you safe and with shelter. What we have not done is agreed to give her cash.
Right, and that's what she's mad about.
Our fear is to do that is enabling her, and she will take that and spend it on drugs. She's called up in a panic saying, oh my gosh, I need money for truck repairs. And we'd say, hey, listen, no problem. We'll have one of our Florida staff members come over, get you, take you there, pay directly. No, don't want that. I'm not a child. You're treating me like a child. Then she'll come back and say, well, I'm in withdrawal and I need cash to get the drugs, and it's only to help me. This is just for my pain. Sorry.
Right.
So then she calls and says, well, you know what? I need money. I need cash because I owe money to some not very nice people, and I'm in trouble if I don't pay them. To which we said, no, we're not going to give you money to pay a drug dealer. Listen, let's be honest here. This is a disease. It has a powerful grip over her, and she is deathly afraid of not having access to her next fix.
And I get that. Dr. Phill, my mother died from alcoholism at the age of 60.
I don't want to see that happen to Alexandra at 60 or any other age.
Coming up.
I really, in my gut feeling, I think Alexandra has stooped to some really, really low levels with Tony as far as what's going on in that hotel room in her desperation to get drugs.
My fear is that she could die before we can get to her.
We now return to the Dr. Phill family. Alexandra in danger.
I wish I could grab her by the scruff of the neck and kidnap her to rehab, but that's just simply not possible.
Marty and I have taken the same approach you have, Dr. Phill. She wanted the cash. We said, no, we will go and do this, but we will not give you money. And she was very angry.
She has quit her dialogue with us at this point, one of many times. We do believe she will come around. She will reach out to Beth. She's going to have to get desperate. She's going to call, and she's going to run out of meds and have no money to even get them from a doctor. She's going to be in withdrawal. She's going to say, help me, help me, help me. And the answer to that is going to be, we will put you on an airplane and escort you out here and put you in the proper medical treatment facility. But we're not going to continue to listen to your hollow promises. We're not going to play a charade of you're too busy with school, etc., etc. What I fear is that she's going to have a car wreck or drive under the influence or have some kind of a problem before we can get her to safety.
Dr. Phill, I have to tell you that I think that I really, in my gut feeling, I think Alexandra has stooped to some really, really low levels with Tony as far as what's going on in that hotel room in her desperation to get anything, to get money, to get drugs. And I think she's sold her truck, and I don't mean to seem so calloused. It's just heartbreaking, and I can't give my emotional energy to Alexandra anymore. Does that make sense?
Well, it does make sense, but I think we're coming up to a fork in the road here. My fear is that she could die before we can get to her.
Do you think that we should try to do an intervention, an official intervention with her? Would that have any impact with her?
I think she is very savvy, and I think she is very resistant, and I think there is going to be a moment in time where she is vulnerable and will respond, and I believe that will be probably with her father.
And I agree with you.
But unfortunately, I have to tell you, Dr. Phill, Marty is in some serious denial.
I talk to her on the phone. She always seems like she's plugged in with me, okay? Our kid is never around us acting all whacked out on drugs. She always looks presentable. She's clean. Maybe I'm living in denial, but if I see needle marks on her arms, I don't see any of that.
No, she smokes it.
Well, I'd rather she smoked it than injected.
It's very hard for him to get his head around the fact that Alexandra is where she is right now. He knows it, but he doesn't want to believe it. Does that make sense?
Well, it does, and I don't want to put this on Marty in terms of him having her life in his hands. Her life is in her hands. If there is any influence that you can bring to bear, if there's any influence that Marty can bring to bear, if there is anybody that can get her ear and get her here, we have top-of-the-line treatment ready for her if she will just walk through the door.
Just got off the phone with Dr. Phill, and he really thinks that the best gift that you can give to Alexandra is to really help her to understand that she should return to LA and follow with the program that Dr. Phill has planned for her.
I'll definitely give her a call and see what's going on.
I feel like you might be a little nervous about what you're going to say.
Yeah, of course I am.
Whatever it is that you say to her, I know you're going to speak from your heart, and it's going to be the right thing. And that's all we can do, okay, is just put it out there. All right?
Mm-hmm.
It's going to be all right. You're a good dad.
Communication with Alex came to a complete halt. Nobody knew where she was, who she was with, or if she was all right. Her phone kept going straight to voicemail, and her family started getting very concerned.
Guess I am nervous. Hey, sweetie, it's your dad. Give me a call, will you? It's Sunday about 1:30. Man, went straight to voicemail. Just want to see what you're up to. I love you. Bye. Well, it's the third time I've tried to get a hold of her. Hey, Alexandra's dad. Trying to get a hold of you. Give me a call, babe. Bye. I think that's number 5. Hi, babe. It's your dad. I've been trying to call you all afternoon, see how you are. You're beginning to really worry me. I don't know why your phone's off, but give me a call. You know the number. I love you. Call me. Bye. This is about the 7th time I've tried to call Alexandra today. We're actually just right up the street from the mobile home she could be staying in. It's just really sad that she's in this kind of environment. It's time that something be done soon.
We are staying on top of this. We are going to put up a fight to save Alex from herself. Because I want people to believe it's never too late to change, and it is not ever too late to change. Now, a lot of you have been very vocal on the Dr. Phill message boards, and I want you to continue to let me know what you think. Plus, Erin has rejoined the Dr. Phill community, so be sure to log in and read more about what she's going through during this difficult time. As I've said, we're not interested in giving Alexandra any cash because we are just worried about where it might go. But we are trying to help her in other ways, and so I gave her a $500 gas gift card so she at least doesn't have an excuse to not go see her children. So I want to thank the folks at Shell. They're very generous, so let me just say thanks to Shell nitrogen-enriched gasolines, which help protect your engine for performance-robbing gunk, for this gift card to Alexandra. I hope she uses it for the right reasons. We'll see you next time.
Today on an all-new Dr. Phill.
We're going to be dishing out some 5-minute fixes.
Fast remedies.
My husband is a hypochondriac.
I'm driving myself crazy.
You're not crazy.
For a better life.
She has had 6 nose jobs.
I've never been happy with the nose. I have a quick fix.
5-minute fixes.
I am afraid to go to a gynecologist.
You trust Dr. Masterson.
I feel like I know her.
Yeah. Would you like to know her better? This is going to be a changing day in your life.
Have a good show, everybody. Here we go.
If it matters to you, that's what I want to talk about. Are we ready in the booth? Let's do it. Go, Dr. Phill. Often said that we don't do 8-minute cures on this show, but today, well, that's kind of an exception, because we're going to be dishing out some 5-minute fixes to some things that really crop up in your life a lot. Throughout the show, we're going to be giving you some of the most efficient, effective ways to better your health and expand your lifespan. But I'm not going to do this alone, because joining me today are America's medical dream team. You know them as the host of the Emmy Award-winning daytime hit, The Doctors.
Doctor, give me the news.
Make a fist, and you're going to grab inward thrust.
This right here, that's your frontal lobe.
That is such a cool thing. Nice. Yeah, lift the bump. There we go.
Trying to keep the computer from scoring here, Travis.
Pretty cool. Very quickly, 100 per minute.
Hey. Don't you do to me what you do to him.
I don't want to die. I'm not going to pass.
I wanted to say thank you to all of you.
Please welcome Dr. Travis Stork, Dr. Lisa Masterson, and Dr. Andrew Orton. Good to see you. So much. Good to see you. You're all right. Thank you. All right, now. Thank you. All right, now. Dr. Jim Sears, also a cast member here, couldn't be here today in person because, well, it's flu season, and that's like tax season for accountants. So he couldn't get out of the office because he's got little kids lined up around the block with flu, and we said, stay there, we're going to have him here by video. But he sent along some of his quick fixes for everything from flu-proofing your family to lowering your blood pressure, and we're going to give them to you throughout the show. But first, Dawn wrote to me because she says her husband, Randy, is a hypochondriac, and she says she just can't take it anymore. Take a look.
My husband is a hypochondriac.
I think about my health all the time. Every night when I come home, I'm usually on a computer for 1 to 2 hours, just searching for different remedies.
Randy has researched anything from having a heart attack, gout, kidney failure.
Anytime I feel a pain in my body, right away I think the worst. If I start to get a pain in my calf, that could be a blood clot starting.
If Randy has a sore throat, he thinks that he's got cancer of the throat. If Randy gets a pain in his arm, it's definitely a heart attack. If Randy has a bad headache, it's always a brain tumor. Randy constantly checks his pulse. Sometimes he even checks mine to see if mine was as normal as his was. We have a daughter who is 7, and he was also testing her.
I'm very afraid of dying. A lot of nights I didn't even want to go to bed because I'm worried I might not wake up.
We've gone to the emergency room probably once every 4 months because Randy thinks that he's having a heart attack. Randy has never had a heart attack. If Randy doesn't seek help, I really have a feeling that he's just going to drive himself crazy.
Is there something that I can do where I wouldn't be so consumed about my health and about dying all the time?
Okay, now this is interesting because you realize that what you're experiencing is not rational.
Correct. I'm driving myself crazy over it, really.
Okay, and Dr. Stork, that's not usually what you hear from someone that describes himself as a hypochondriac. They come in and they think, no, I am dying. This isn't craziness, I'm dying.
Right. So you at least have some insight. But the one thing that you know is if you obsess about your health, that's not healthy.
What do you understand hypochondriac to mean? I got a feeling you know the answer to this, but what do you just think it means?
Well, constantly worrying about your health. You know, every time you get a little pain, it's more than just a pain. If I get a pain in my back, right away I think the worst, that it could be kidney failure, my liver's going out, or I have a tumor growing, or, you know, something like that.
What's your payoff for this? What do you get out of it?
A lot of stress.
No. You get something out of it. Look, people don't do things over and over and over again if they don't get some reward for it. Are you a drama king?
No, I don't think so.
Well, but yeah, how can you say no, but a muscle twitch is a heart attack? I mean, isn't that drama?
It is.
He's a drama king in the sense that he's going to do research on it and find out what it could be.
Randy does have some actual health problems, but he refuses to follow his doctor's orders when he does have something wrong. Take a look.
Instead of following the doctor's advice, Randy reads what other people write on the internet and follows their advice. Randy has battled gout for approximately 15 years. Randy opted not to take the prescribed medication and just do his own remedies.
I take black cherry extract twice a day. I also do take turmeric.
Randy found that lemon juice and water is supposed to help with his gout. At the end of the day, the gout is still there even after he's tried all these internet remedies. All the remedies that Randy has bought just sit in this cabinet, and even if they're expired, we can't throw them out because at some point Randy may need that remedy again. I think Randy needs to get to the doctor. He needs to take some blood tests and find out really what's going on with his body.
Okay, now actually there are some things that you can do on your own to manage your health, of course. In fact, Dr. Travis Stork and the doctors have put together a new book called 5-Minute Health Fixes, and it's full of easy tips to improve your life. I was asking you about your payoff. What do you think I mean by that?
I don't know. I really don't know. I don't think there is a payoff worrying.
What do you think the payoff is?
I don't see a payoff in any of this.
Well, just assume for me that we don't do things repeatedly that don't pay us off.
Well, I'm guessing that, yeah, he's relieved when he finds out that, you know, the symptom is gone and he's okay in his own mind.
Am I missing something here? Do y'all get what I'm saying? You do stuff because it works, right? You get something out of it. You do it because you get something out of it, right?
No, I really don't.
I see a lot of people in the emergency room who have symptoms and they accentuate them, especially nowadays, because you can go online, punch in a symptom, headache. Next thing you're reading about a brain tumor, and then you'll come to the emergency department and you're telling me you have all the symptoms of a brain tumor, not because you have them, because you read about it and convinced yourself you have them. So it's a dangerous time.
We've even developed a new term for that. It's called cyberchondria. Okay? It's called cyberchondria because people go into cyberspace, they look all of this stuff up and are highly suggestible. So they read all of this and go, oh, yeah, I have that. Oh, yeah, I have that. I do. And so they self-diagnose at that point and then become very stressful.
Sure.
And that you do that some, don't you?
Oh, I do it a lot. I do it a lot, yes. Yeah. I mean, almost probably every night. I mean, you know, if I'll get a pain in my side, then I'll go online and research it. And, you know, then they tell you about a appendix and your appendix going bad and it's a short one where you can die and it can explode. And so it's like, you know, how long do you wait? Should I go to the doctor? And shouldn't I go? And so, you know, when the pain goes away, it's like, ooh.
So when you look all of these up and it turns out you don't have them, you're relieved.
Well, I don't know that I don't have them till the pain or symptoms go away. Then I'm relieved.
I think I'm getting a brain tumor. Dr. Travis says that you should only use valid websites to research conditions that you have actually been diagnosed with. You know, wait till you're diagnosed, then do your homework, then do your research. Now, if you go to drphill.com right now, we're going to have a list of them for you there. Now, next, I'm going to tell Randy what he needs to do to stop stressing about his health and to really control this, because it really is disruptive to your life. And later, a woman who's thinking about having her 7th nose job. We'll be right back.
Randy has this vitamin case that he carries with him every single day.
I have turmeric in there. I have pantheoathic acid, aspirin I keep in there at all times for heart attack. If I don't have my vitamin pack with me, I start thinking what happens if I start to have a heart attack or chest pains or whatnot. Then what am I going to do?
We were going to go on a cruise, and they were predicting bad storms, and Randy was worried that if he got on that cruise ship and the water was a little bit rocky or wavy, that he was going to have a heart attack and he wouldn't survive. So we had to cancel our trip.
This isn't malingering. He's not faking this to get out of doing something or going on a cruise or whatever. This is very real to you at the time. And your concern is very genuine, right?
It is.
And it's very stressful to you.
Oh, absolutely.
At the time. And often underlying this is anxiety. And it's not anxiety about any one thing. It's just stress and pressure, and it has to find an outlet. And in this case, the outlet has seemed to be an overemphasis, an overfocus on symptoms that are misinterpreted as being something more serious than they are. What you have to be willing to do is to accept that this is from something else, and that something else is anxiety. If we can teach you how to manage anxiety without having to get into this cycle of build, 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 relief, build, 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 relief, build, 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 relief, if we can teach you to do that in a more constructive way, then your need, subconscious or otherwise, for overemphasizing this symptomatology would go away. One of the ways that you do this is through what's called biofeedback training.
Okay.
And you are so attuned to your body, where you listen to your body so well and you focus on it, that those skills can actually be used very productively to help you gain control in this other area. You're not crazy. This isn't some kind of bizarre mental illness here. Okay. You need some alternative coping skills to handle this. And if I arranged that for you, would you do it?
Absolutely.
To get you some biofeedback training and get you some ability to manage this anxiety, you would do that?
100%. Sure.
Dr. Travis Stork also has some advice on when you should go to the emergency room, because I don't want people to get the message that you just ignore all of these things. You overreact to it, right?
I do.
If you're in doubt, you do want to get it checked out. No question about it. Let's say you're suffering from a headache. You know, if this is acute onset of the worst headache of your life, and you have confusion and fever and a stiff neck, or let's say you've lost consciousness and you have a continued headache, you want to go get that checked out. Don't minimize that. Or let's just say you're at home and you have nausea and vomiting and severe diarrhea. You can't keep down fluids. You can get dehydrated very quickly. So don't be a minimizer and say, oh, I'll be all right, even though I can't get out of bed. So there are times where you have to listen to your body. But you prove to be challenging for doctors like us, because we don't know when it's real or not real. That's why you need to get this fixed.
Absolutely.
And these are things that you guys cover in the book, 5-Minute Fixes. There are some of the things in there that you just need to know, so you know when to pull the trigger and actually go to a doctor versus when not to. We're going to approach this from a different area. We're going to look at what's underlying this, take that need away, and I think you're going to see this dissipate in fairly short order.
Great.
Okay?
Very good.
Great.
You'll be relieved, right?
Absolutely. Yes.
All right, good deal. All right, next, she's 20 years old, and is terrified to go to the gynecologist. Plus, how to enjoy your holiday cocktails and not get that hangover. Yeah. But as we go to break, here's Dr. Sears with a tasty 5-minute fix to lower your blood pressure.
Hey, Dr. Phil. Hey, doctors. Here's some great news for all those chocolate lovers out there. You can actually lower your blood pressure by eating dark chocolate. An Italian study found that if you eat one small piece of dark chocolate every day for 15 days, you can lower your blood pressure by 6 points. And it significantly enhances your body's insulin response, which is a key at preventing diabetes. But remember, we're not talking about the whole bar, just one small piece.
Alicia, and Allison.
Our question is, how do you cure our hangovers?
After a night of drinking, I'm usually on the bathroom floor the entire next morning being sick.
I usually go to the bathroom numerous times throughout the night to throw up.
My hangover means I spend the entire next day in bed. I get terrible headaches and experience light sensitivity. Please help us.
Dr. Travis, is there a way to prevent a hangover? I mean, can you do it?
Obviously, moderation, drinking water in between drinks, but there's no magical cure for the hangover.
So water, is that to reduce the volume that you drink, or does it just water it down?
Well, a little bit of both. You're staying hydrated because alcohol can dehydrate you, so the last thing you want to do is wake up the next morning severely dehydrated with your hangover.
My next guest, Christina, wants help getting over her fear of going to the gynecologist. Take a look.
Hi, Dr. Phil and Dr. Lisa. I need your help. I am afraid to go to a gynecologist. Ever since I got my period when I was 10 years old, I have dealt with terrible menstrual cycles. I would get pains so bad, hot and cold sweats, the shakes, I'd vomit, I fainted, and had to seek emergency medical help. Every time I think about going to a gynecologist, I freeze, I fight it, I don't want to talk about it. It terrifies me to let a stranger see me that way and touch my private areas that I know it needs to be addressed. 10 years is long enough.
Okay, now my goal is to talk you out of this fear. But, Lisa, the truth is, this has got to, I mean, she has a point, right?
Oh, absolutely, and that's a lot of reason why a lot of women take a lot of time not to go to the gynecologist. It's difficult for a woman to reverse her mindset. There's a stranger, she's going from the pediatrician to the gynecologist, and that's a huge leap for a woman.
What do you think is going to happen that's bad?
I just feel like, from what I've heard of going to the gynecologist, it's basically you get into a room, you take off your clothes, and you let a stranger touch you. Like, what? Like,
no. You just described going to a bar. That's not what happened.
That's what women think. It's all about you taking control of your health and your body, and that's what we have to switch it to, is that you're actually in control of your body, and this is a good thing.
Let's take just a second and talk about the downside of not going to a gynecologist for as far into life as she is.
Now there's an HPV vaccine. We can keep you actually from ever getting cervical cancer because of STDs. So the consequences with STDs are not only that you may have an embarrassing sexually transmitted infection to talk to someone about, but we know it can cause infertility, it can cause severe pelvic pain, it can cause death in certain instances, depending on what you have.
And you have a lot of pain, actually, right?
Yes, yes.
Okay, now your sister Laura has actually tried to trick you into going to the gynecologist. How did you do this?
I've tried to make a lunch date with Christina, go out to lunch, then happen to pull into the parking lot, and then the door's locked, and she's like, I'm not getting out. I've made appointments for her. I've even offered for her to come in and watch me get an exam so she can see exactly what goes on.
Well, that's a generous and fair offer.
And I know she's concerned. You need to go first just to meet the doctor, and that's okay, and then go for the exam second, because the indication for an actual exam is if you're having problems, like if you were having cramps, or if you're 21 or sexually active, whichever comes first. So that needs to happen.
And I've asked Robin about this when we were having our first baby and everything. Do you feel funny about this and all that? And she said it very well all those many years ago. She said, if you go to a professional, they are professional. Your modesty is respected. You know, you're draped, you're covered, you're not vulnerable in some way. People aren't coming in and out of the room. There's complete and total privacy, respect, and professionalism. So this isn't something where you have to feel that you're going to be disrespected or exploited or anyone even being insensitive to your concerns.
We tell you exactly where we're going to touch you at any time if you want to be touched. Again, it's all about you being in control.
Now, you said you actually trust Dr. Masterson because you watch her, right?
Yeah, I've watched the doctor show for several years.
So you feel like you know her?
Yeah, I feel like I know her.
Yeah. Well, would you like to know her better? Let me tell you why I'm asking that. Because you watch the doctors, you know that the doctors has an exam room, a very professional examination room, no cameras. No cameras, just cameras to kind of introduce people. Here it is. See it right here. Wouldn't this be a great time with a doctor that you feel like you know and trust to go and have that first preliminary exam and get it over with?
Yes, it
Would you do that?
Yes, I think so.
Are you willing to do that?
Yeah, I'll try.
All right. Up next, she had 6 nose jobs and now wants a 7th. Plus, how to flu-proof your kids, and then we'll hear about how this goes by the end of the show. We'll be right back.
I've had 6 nose surgeries, and I am still not happy with the results. I was always hoping it would be the last surgery, but there was always something that I was disappointed in.
Here are a few really important tips to keep you and your family healthy during flu season. First, you gotta eat well. Lots of fruits and vegetables and lots of fish. Those things really boost your immune system. Next, you gotta exercise. Staying active will boost your immune system also. Prevent the spread of germs. Have a little hand sanitizer in your purse. When you pick the kids up from school, have them use it. And if they're gonna be coughing, you teach them how to cough the right way. Don't cough into your hands, kids, because that's gonna spread the germs also. Cough into your elbow. I call this a birdie cough. That's how birds cough. Or, for the older kids, a vampire cough. Whoa.
That was Dr. Sears from the Doctors. That was a great tip, and you can find more great advice in their new book, 5-Minute Health Fixes. Now, my next guest, Cynthia, says that she has had 6, count them, 6 nose jobs, and is now contemplating a 7th.
I've had 6 nose surgeries, and I am still not happy with the results. Growing up, I was not a pretty child, and I was never happy with my nose. I had been wanting to trim it down and make it look more feminine. I had my first procedure done in 1981. I didn't feel that the difference was appreciable. The second procedure was done in 1984. I was not happy with the result. I had a 3rd surgery. In 1996, I found a teaching hospital in my area. I had 3 procedures done at this hospital. After all the surgeries I've had, no one has ever said, "Gee, you're looking good these days." No one's ever noticed. I wish the doctors had listened to me more. I have never felt that they have done what I asked for. After 6 surgeries, I wonder if my nose could handle a 7th one. I would like to know if I should have a 7th surgery or to leave well enough alone.
Okay, what's your gut instinct tell you?
That it should have been corrected the 1st or 2nd time.
How does this happen, Dr. Orden?
Well, you know, that's the thing. I think for plastic surgeons, nasal surgery, without question, is the hardest procedure that we do. And you can do a perfect operation and not get a perfect result. Your first procedure you had done, you were still a younger woman, and you just wanted a little definition in your tip, correct?
Yes.
What happens every time you operate on a nose, altering the anatomy, in spite of an ideal surgery, things can settle in a funny way. The patient's not satisfied.
Oftentimes, patients will have a problem with self-esteem, they'll have a problem with self-confidence, and they'll kind of target that into one body characteristic. and they'll kind of become obsessed with that. Do you think that your focus on this over all of these years is to the point of being counterproductive, point of being obsessive?
It's absolutely excessive. I don't know about obsessive. I may have been preoccupied with my nose, but in general, I'm a very happy person. I'm accomplished, but I've never been happy with the nose. Without makeup, I still have a very homely face. I was taken for a boy several times, all through my childhood and 20s. Yeah.
Is that part of your motivation, that if you had a finer line nose, that you might look more feminine?
I just wanted a more feminine nose.
You know, we see this with nasal surgery, that you go so far, but you're not quite there, and you want a little more. So we do see this, but you know, each time you do an operation on the nose, it's more difficult to change it.
Well, something
going further.
that jumped out to me, and tell me what you think about this. You said the first one was done at age 30, but then you said numbers 4, 5, and 6 were done by a resident.
It was done at a teaching hospital.
You know, and I know where it was done. Excellent facility and excellent institution. And the point being here, when you get to the point of 4th and 5th noses, those are probably not best done by a resident. A resident is just not in a position to handle that because that's a very difficult case.
One of the things that I did in practice is plastic surgeons, if they had a question, they would sometimes send them to me for evaluation to determine whether or not there would be a possibility of a good outcome. So I've been in this situation a lot, and had you come to me and I'd evaluated you to make a recommendation to the surgeon, I would say not just no, but hell no. You don't want to do this. I mean, if this went badly for you in some way, you would have taken a situation that is wonderful, and taken the risk of going really wrong.
Dr. Phill, you're talking like a nasal surgeon. In all fairness to her, a couple of these procedures that she had done were related to breathing problems. That the nasal surgery that she had initially ended up giving her breathing problems she didn't have. And that's a little bit of a vicious cycle that we see with noses. That's why it's so important to identify those going in.
Well, we have a photo here of Cynthia's profile. And so, Dr. Worden, I mean, tell us what you think.
Well, you know, and I think we're all in agreement. Who would say that she looks pretty good here? And seeing you know, I think that your tip projection is pretty good. You have a nose that fits the rest of your face. I have a solution for you, a quick fix, and all it involves is an injection, not in your nose, but in your upper lip, your premaxilla. And what it entails is just bringing out your lip. Do you see that? And what that does by doing that, by bringing that out slightly, it makes your nose look a little bit shorter. It gives it the appearance of being deprojected, and makes it look better. Without touching the nose, a quick fix, which will give you a little better look, and I think help you your biggest deal. You still feel your nose looks too big.
That makes sense to you? Would you consider that?
I would absolutely consider that.
Then can you do that?
I can do that.
All right, we'll do that for you.
We'll do that for you.
All right? Yeah, big stuff. All right, coming up, we're talking about how to eat less sugar and have better sex, but not at the same time. We'll be right back.
Here's one of my favorite healthy food substitution tips that your family might not even notice. Instead of using sour cream, try switching to low-fat Greek yogurt. It's so much healthier for you. Serving for serving, low-fat Greek yogurt has less than 1/4 of the fat, 1/3 of the calories, and 3 times more protein than sour cream. So whereas sour cream is actually bad for you, Greek yogurt is good for you. Why not make the switch? As a matter of fact, a few weeks ago, I was kind of tricky with my family. I emptied out the sour cream container, poured in the Greek yogurt, served it with our tacos, and nobody knew the difference.
Hi, Dr. Phill. Hi, doctors. I eat way too much candy. Ever since I was little, when I would go to restaurants, I would eat the sugar packets right off the table. As I got older, I would spend about $30 on Skittles, Sweet Tarts, Smarties, and Fun Dip, about 2 to 3 times a week. I began to try to cut out candy. It only lasted 48 hours. I couldn't get out of bed. I had an awful headache, and I feel like I crave sugar. Is it all in my head? How can I end this sugar addiction?
All right, well, that was Emily, who wants to know how to break her sugar addiction. And here to help me answer that question are 2 of the hosts of the daytime Emmy Award-winning hit, The Doctors. Now, they've put together a new book called 5-Minute Health Fixes. Emily's going to join us via Polycom. Emily, are you there?
Hi.
Hi.
Hi
now,
there.
You know you're eating a lot of sugar, right?
Yes, it's a major problem that I know I need to stop.
Okay, and you've been doing this for how long?
Ever since I was really little. It got bad once I got my license, though, and I could just go get it on my own.
You're eating 12,855 teaspoons of sugar a year. A year. And that's over 600% of what is recommended for her to be taking. Travis, what do you think?
The problem is nowadays you can pick up a package of anything on a grocery store shelf or soda that's loaded with sugar, and it's a reinforcing cycle because it actually increases the release of neurochemicals that give us pleasure.
Right. I said you were eating a lot of sugar. Do you have any idea what that looks like, 12,855 teaspoons?
I have no idea.
Well, let me show you. Let me show you. Because we are talking about a lot of sugar. Are you surprised?
Wow. Is this why we have Emily on Polycom? Because she starts salivating?
Think about this. Whoa! You're putting that into your body day after day after day after day after day.
You know, Emily, I'm going to appeal to your vanity. We know that eating too much sugar in the diet has a bad effect on your skin and aging. I mean, that's for sure. So that's another reason why you've just got to nip it in the bud.
Every year that we go through life, our metabolism slows down. So when you're a 19-year-old, your body is primed to use sugar as the main source of energy. But the longer we go through life, the more hours of TV watching we do on the couch. What happens is that sugar settles around your belly, and it creates something called visceral fat, which leads to heart disease, diabetes. I think the biggest issue here is Emily, just like all of us, we're getting a lot of sugars in things that we don't even realize.
Yeah.
Your pasta sauces are sometimes loaded with sugar. When you go buy processed crackers, loaded with sugar.
Okay, now, Emily, here's the thing. You need to understand this is a form of addiction. After you get this out of your system and then you start to eat it again, it's going to seem really sickening to you. Emily, do you think you could go cold turkey on this?
Well, I've tried, and it was a complete failure.
But here's what you got to be willing to do. You got to get the people around you. You got to get your friends. You got to get your family. And you got to tell them, you need to treat me like an addict for about 3 or 4 days here and pat me down when I come in. If I got a Kit Kat bar on me, take me down and get it away from me. And you've got to resolve, you know, for 72 hours here, I'm going to do it. And I promise you, if you'll get through those first 3 days, you will be a whole lot better off. Fair enough?
Fair. I can do it.
We'll see. I want to hear from you after 72 hours, okay?
Okay.
All right. Where's Maria? All right, Maria, you have a question. What is it?
I wonder why guys have it more difficult for an orgasm when they're drinking, but at the same time, it feels like they're more interested of having sex.
Okay.
Who gets to answer this one? I'll arm wrestle you for who gets
You win. But how about this? You answer the first part. Why, after a few drinks, is a guy more interested in sex?
Well, obviously, because it's just relaxed him. It's decreased his anxiety level. He's free and easy and relaxed.
And after a drink or two, both men and women, they do relax. And so it can be a bit of an aphrodisiac. But the problem is alcohol is a central nervous system depressant. And you need your central nervous system as a guy to make things happen down there. And the more you drink, the less you're able to do that, because the depressant action of the alcohol is saying, all right, this isn't going to happen. And so the guy may want it to happen, but it just can't.
It also distorts their self-perception. Because they may look like Pee Wee Herman, but after a few drinks, they think they're James Bond. So, and they walk in and say, yeah, every woman in here is looking at me. All right, when we come back, a mom who needs a fix for stinky feet. Plus, we're going to find out how Christina did in the lab next door at the doctor's. We're going to hear from Dr. Lisa. Find out what happened. We'll be right back.
I'm Erica, and this is my daughter Layla, and our problem is we have stinky feet. Layla's only 8 months old, and her feet already stink. And I've been dealing with the issue since high school. I've tried powders and sprays, I've tried different shoes, different socks, and nothing seems to work. They pretty much smell like garbage. And my husband even makes me wash my feet before I go to bed. Can you help me?
Well, that was Erica with actually a very common but yet embarrassing situation, but luckily there is a solution, and Mel back here is actually soaking in this. So, Dr. Stork, tell us what she's doing. Obviously, she's in some, it's just regular tea?
Black tea? It's black tea.
Black tea.
So if you brew up black tea, a big batch of it, pour it into a foot bath, let it cool, obviously, and soak your feet for about 30 minutes. Not only is it soothing and relaxing, but the tannic acids in the black tea will actually help dry out those sweat pores and kill off the bacteria. Because the bacteria that grow and feed off that sweat, they release the odor. It's not your feet, it's the bacteria's fault.
You've been soaking in this for how long?
About just maybe 2-3 minutes. It smells great, great aroma.
How often do you have to do this?
You should do it every day for a week. And then after that, as needed.
All right, now, before Dr. Lisa answers another question, I need to find out how things went with Christina in the doctor's lab. So, how did things go?
She did great. She just flew through it, and I know she feels so much happy about it, and she just, everything's healthy, and she just did fabulous.
So, first off, you didn't find any problems at all?
Didn't find any problems. Everything's nice and healthy, perfect. She just breezed through that.
How do you feel about having gotten it done?
Much better.
You feel relief that you're through that?
Exactly, especially since she said everything looks good.
Well,
so that's like, whew, thank gosh. But it wasn't as bad as I thought it would be.
All right, we have another question for Dr. Masterson about menopause. Judy, where are you? What's your question?
I'm wondering if it's okay to go off of estrogen just cold turkey, or do I need to wean myself off of it?
That's one thing you don't want to go off cold turkey, because if you go off cold turkey, it's going to kick you back, you know, it's going to give you a little kickback, and you're going to get hot flashes or other symptoms that you had back with a vengeance. So that's something you want to wean yourself off of. So talk to your doctor about how to wean yourself off of it, what's the best for you. So yeah, don't just stop cold turkey. We want you to be on the least amount as possible for the shortest amount of time. That's the recommendation now. So you do want to wean off eventually.
Okay, thank you.
Cool. All right, we've got one more question from Deborah about burns. Deborah, what's your question?
What is the proper way for us to treat burns? Because I'm tired of soaking myself in fat.
People of color are more likely to form scars, so treat a burn the right way from the get-go. And we get into this a little bit in the book. I don't know if you've heard this wives' tale. Number one, don't butter a burn. That if you have an acute burn, you don't want to put butter on it. That actually can help promote the burn to be worse and lead to infection. The best thing to do is to immerse a burn in cool water. After that, if you have a second-degree burn with a blister, don't pop it. Let it just rest there naturally. You want to apply something moist in the form of aloe or a triple antibiotic ointment. That's a good thing for a burn. And put a bandage on it that doesn't stick, so that when you peel it off, you're not peeling the skin with it.
Yeah. All right. Good advice. All right. I appreciate it. And also, on the website, we're going to have do's and don'ts if you're thinking about getting some plastic surgery done. Dr. Orden has those for us. We'll have those on drphill.com immediately after the show. We'll be right back. Well, I want to talk about an exciting event that's coming up. For the first time ever, Susie Orman, Dr. Oz, and I are going to appear on one stage together in Ask Oprah's All-Stars. This is a 4-part, 2-hour special on OWN, the Oprah Winfrey Network. Now, Oprah's network launches on 1/1/11. And let me tell you, this is going to be exciting. I'm really involved in this network with Oprah, I'm proud to say. I'm doing a number of different projects with her, including Ask the All-Stars. I'm doing a series called Finding Sarah that deals with the Duchess of York, Sarah Ferguson. We've been doing something called Get Your Own Show to find the next talent that will have their own show on the Oprah Network. And you're going to be able to see the Dr. Phill show every night on the Oprah Network as well. So we're very excited about all of this that's coming up. So Ask Oprah All-Stars premieres on Sunday, January 2nd at 8 o'clock, 7 Central. Now, we're going to be answering your questions about relationships, health, your body, and finances. Now, our goal is to help people live their best life ever in 2011. And you can ask us anything. So go online now and send us your questions. You can go to the Oprah All-Stars page on Facebook, or you can go to drphill.com for a link to Oprah's All-Stars. Now, as for today, I want to thank all of my guests for being here, especially Dr. Travis Stork, Dr. Lisa Masterson, Dr. Andrew Orden, and a special thanks to Dr. Sears for his great tips as well. The doctor's new book, 5-Minute Health Fixes You Want on Your Kitchen Cabinet, so you can pick it up if something happens in your house. It's in bookstores now, and let me tell you, it just makes a great holiday gift. And everybody in the audience today is going home with a copy of this book. Thanks for being here. So